Hello and welcome to Catamount Community Connection, our public affairs program we hear every Sunday. And here on Catamount Radio, your host, Brian Collamore. And we are, again, going to speak with a community leader. We try to get to the business, professional, nonprofit, and political arenas from time to time. The legislative session is underway as we record this on Monday, January 20th, and it will air this coming weekend. And we have not, at least as of this recording, passed any new legislation. I believe there were 18 bills that were introduced in the Senate, none of whom have left their jurisdictional committees, so we haven't voted on anything there. I don't know as much about the House situation, but I'm sure there are many more bills there because there's many more people there. Our program, as you well are aware, is brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland. Since 1846, we're already looking forward to 179 great years of hosting the Vermont State Fair here in Rutland. We're very pleased today to welcome in Dick Courcelle. I don't believe Dick has ever been on the program. Dick right now is the CEO of what is known, by two different names. We call it Community Care Network, and that consists of both the Rutland Mental Health Services and the Rutland Community Programs. But I thought, as we do normally, Dick, with anybody that hasn't been on the show before, you can sort of tell us who you are, where you went to school, and how you wound up doing what you're doing right now. I know you've had other charges in the past, so welcome in.
Oh, thank you, Brian. Yes, certainly it's been a winding road. Community Care Network, though, who I'm representing here today, I've been with that organization since 2007. So, excuse me, that has been an organization that I have enjoyed working for in various capacities. And of course, back in 2015, I was asked to step into the role as Chief Executive Officer, which is something that I've been doing ever since and absolutely love that role. Yeah, in terms of my background, as I came into the studio today, I just recalled all those years ago. I started, my career path has been very a winding one, especially in the beginning. I was born and raised in Rutland. Excuse me, I've lived elsewhere, graduated from Castleton with a degree in psychology, and went to Boston, worked at Children's Hospital in Boston. After graduation, I was considering doing a doctorate program in psychology, was accepted at a program in New York City, and went, and then decided I wanted to perhaps do something a little bit differently. So my path, I ended up 8 wonderful years at Killington, where I was the Director of Public Relations. And I recall, as I'm coming into the studio, which looks completely different than it did back all those years ago, the close relationship that Killington had with these stations, and the number of times I was in here on one show or another, and certainly with you as well. And after that, I was really honored to be the head up Downtown Development Corporation, which of course is the Downtown Rutland Partnership. I was the first executive director, and worked side by side by my colleague Matthew Sternberg, who was headed up the Rutland Redevelopment Authority, a commission that I am serving on again in Rutland City, which I really enjoy. And I was with that program for 9 years, and it was just an absolutely great experience in the revitalization of downtown Rutland, and I'm overjoyed to see that revitalization is really being kickstarted again, which is so important to this community. And after that, I was there for, I think, 9 years, and then went to Central Vermont Public Service Corporation, one of their unregulated subsidiaries, and stayed there for a while. And then, I ended up here with this organization. So my background, and I mean, in the course, I received my master's in administration from University of Vermont, and did advanced training in finance, and other areas. So this was kind of natural. So I've been with this organization since 2007. It has been an honor to be part of this. We have about 300 employees overall, spread out throughout the region. So it's been an exciting journey so far.
I can remember the days of the DDC. and I used to work here at the radio stations and was in sales, so we had coordinated on a number of sort of events that that downtown group was sponsoring. And now, of course, you're right, it's called the Partnership, which is probably a little different makeup, but I'm sure some of the merchants and business folks who were in the DDC are still members of what is now the Partnership. So, yeah, and you're right, there's sort of a recycling of opportunity. We do have some empty buildings, or at least I shouldn't say empty, unoccupied at the moment, which we need to fill. And I know there's a group of very dedicated and, for the most part, younger folks who are grabbing that mantle. Casey McNeil, one of them that comes to mind for McNeil and Reedy. So I've still got to get to him and get them on the program. I did reach out. Gosh, we've been doing this show now a year and some odd months, and I still haven't been able to get a firm date for that group to come on. But anyway, you are now, as you mentioned, the chief executive officer of what is commonly referred to. Probably more people realize or recognize Rutland Mental Health than they do the Rutland Community Programs. And we had a meeting of the legislative delegation. The Community Care Network folks come in and explain sort of what they do. So we have, for the next 50 minutes or so, the opportunity to talk about some of the services you provide. I know, based on what I heard at that delegation meeting, that there will be some changes. And change is always hard to accept in some ways, because it does deviate from what is going on at the moment. And it's often, when you get a chance to reflect back on those changes, you decide either, hey, we did a really good thing there, or whoops, we kicked the ball in the wrong direction, and maybe we'll go back and do stuff that we did before. So I'll just sort of throw it open to you and let the listeners know exactly what it is that the Community Care Network does in the region.
Sure, and you're right. We have two organizations under the Community Care Network umbrella. In fact, it's interesting when people hear Community Care Network. What, is that a new name you just came up with? Actually, I think that name has been in existence since I think around 2000, 99, 2000, which you get to a certain age, and 2000 seems like it was, what, was it 5-10 years ago? But turns out it was a lot longer. And when you're talking about, McNeil and Reedy and Casey, who I believe is the chair of the Rutland Partnership Board, but Jim and John, we're the same age, so it's to recognize that time is flying. So in any event, Rutland Mental Health Services is the larger of the two organizations that are under the Community Care Network umbrella. And I'll kind of start with just describing our other organization, which is Rutland Community Programs. And a lot of folks are familiar with the programs of Rutland Community Programs, but may not understand the kind of the structure behind it. So under Community Care Network, we have the two organizations. Both are separate corporations. They're 501c3, they're charitable organizations, and they both have separate boards of directors. There's no interlocking of the boards of directors. So on the Rutland Community Program side, a lot of people are certainly familiar with Green Mountain Foster Grandparents, the Retired Senior Volunteer Program, 1-to-1, which is a program that volunteer drivers drive individuals to medical appointments and necessary appointments, and also Head Start, Rutland County Head Start, which is also a program. Those are our programs. Those are the programs under the Rutland Community Programs umbrella. And there were other programs over the years that have been part of that, smaller grant programs, for example, that have expired because the grants went away. But that's an organization that really takes on a lot of community initiatives, grant-type programs that are part of both our senior population, older adults, and volunteerism, keeping people engaged. We all know as we get older, that does not mean that your engagement in your community should lessen. It may change somewhat, but continuing to be engaged in your community, active in your community, feeling like you're making a difference, connecting with, different generations, because there are, as you know, there's new individuals taking the reins, and so that's what these programs are about. And then, of course, our Head Start program is dealing with, infants up to the age of 5, and that's a federally funded program, but it's a program of us. And we just started offering much needed infant care about a year ago in that program through our federal funding. So you have that, and then over the course of years, programs can get added under Rutland Community Programs. So there will be opportunities, I'm sure, in the future for new community initiatives to fall under that umbrella. The organization that most people are familiar with by name is Rutland Mental Health Services, which is the larger of the two, under Community Care Network. That, too, has a board of directors. And again, there's no interlocking, there's no sharing of directors between the two organizations. They are separate, Community Care Network being the overall organization. So Rutland Mental Health Services has been around for, I think we celebrated our 75th anniversary a couple of years ago. I think we're in year 70. I think we're going into year 78. So this has been an organization that has been a part of the fabric of the Rutland region, Rutland County for decades. You know, starting out as a very small organization focused in, mental health for certain subsets of the population. And then, of course, in the mid-1990s, when the Brandon Training School closed in Brandon, which was the state's facility for individuals with developmental disabilities, when that closed, Rutland Mental Health Services took on a whole new component of offering community-based services for those individuals that had resided at the Brandon Training School, and then folks that were coming into the system as well. So we're a pretty good-sized organization, again, with almost 300 employees between our two organizations, and with Rutland Mental Health Services being what the state of Vermont calls a designated agency. And what that means, Brian, is that each area in the state, well, actually, there are 10 designated areas, agencies in the state of Vermont. A couple of them have multiple counties. But what the state of Vermont has done, it has established counties and catchment areas that they provide funding to provide both developmental disability services and mental health services. Rutland Mental Health Services is the designated agency for Rutland County. So while a good deal of our physical office space is located in Rutland City, and we're in multiple locations in Rutland City, our work is countywide. Most of the work that we do is in the community. So that is one of the things that differentiates us. So we offer an array of programs spanning the entire lifespan. And on the mental health side, from birth, actually prenatal for the mom, up through elder care clinical services as well. And we serve over 3,700 people a year. That is growing with some of the new programs that we're introducing. But it's basically we are charged with, looking at what our communities need with respect to support around mental health at all life stages, starting with the very young, with our early childhood program and the work that they do, and with expectant mothers, and right through postpartum depression, and also working with parents with young children with some behavioral issues that they need some help with, right into school-age kids, and up through age 21 for youth. Then we have a very large and robust program for individuals that are of adult age that may need some mental health supports at some point in their aging process. Some individuals who are in our services require supports their entire life to remain engaged with their communities and with their families. And, we offer that support to around 300 individuals, and it really allows them to be active, participating, healthy members of their community. We also have adult programming, everything from wellness groups for individuals that are interested in some aspects of mental health and wellness. We do a lot of work, of course, in emergency crisis services, which you and the other members of the Rutland County Legislative Delegation who were in attendance at our legislative information session this morning heard about. And then, of course, we have a full range of services in developmental disabilities as well, and that is of course changing this coming year in terms of how those services are going to get delivered. But in any event, it's an organization that everybody knows something about. But when we have opportunities like this morning, and there's a number of new legislators in the Rutland County delegation, which is wonderful to see, that people that because that is not an easy job being a legislator, as you certainly know. There's a lot that comes at you in a very short period of time. So to have new people step up, but when they hear about the scope and the breadth of what we do in this organization, they're always surprised, because most folks will know one part of it. Oh, I know a parent who was receiving services for their young child, Rutland Mental Health, or I know this person that was having a really rough spot in their life, and they were helped by our emergency services folks, or I have my parents are a lot older and they've been struggling with some issues around depression or whatever, and so I know that you helped out. But when you present the whole scope, it's really surprising to people, and even me to this day. I mean, really, I learn more about this organization as every month goes by, because there's services that we provide that, sure, I know what the programs are, but when I hear, like we did this morning, from folks that are actually doing the services in the community, and in the case of a couple of presentations, literally on the street, it just makes you realize that the work that this organization does for this community, for this region, is so essential. And if we weren't here doing that work, I think we'd have a much different story to tell. But so anyway, that kind of an encapsulation without getting into the nitty gritty, because there's so many different things that we do as an organization.
We're talking with Dick Courcelle, who is the Chief Executive Officer of both the Rutland Community Programs and Rutland Mental Health Services, put together as the Community Care Network. And again, just for those of you that are tuning in, we are recording this on the 20th of January, which is a Monday. The program will air on this coming Sunday, the 26th. So when we say this morning, you'll have to kind of realize that we're not talking about this morning like when you hear it this morning, but the meeting was held a few days back. And Dick mentioned one of the Danielle was the person that made the presentation about the so-called Street Outreach Initiative. And I think for a lot of people in the community, we talk about perception, and this is something that a lot of people keep hearing about. I was really heartened, I have to say, with her remark about it not being an opportunity to interact with violent folks. She made a point of saying that's not true. When we start talking about the street initiative, in many ways, we are talking about the hotel-motel situation in Rutland. There's other parts to that initiative as well. But I think for most people that think about it, that's what they assume it means, is that those folks go into the hotel and motel programs. I still refer to that population as homeless. I guess we have another way to refer to it now as unhoused, but to me it still means the same thing. And I was on a tour of, trying to think, there's 2 or 3 different hotels. I was both cases at what used to be called the Holiday Inn in Rutland, and was just not very impressed, I have to be honest with you. Not with anything that Rutland Mental Health was doing, but with the conditions that people are forced to put up with. And one of the things that came out as a severe, I say, objection or criticism, I guess, of the way that the state is running it, is that there was no actual requirement that people reach out for support services. They are able to be there and just be there without anything else happening. And in many cases, I think there were people like Rutland Mental Health and the initiative for the unhoused to provide those services, but the people that own the building were not interested, at least at the time. And that may be an unfair criticism, but that's what came back from me touring the facility. And again, I think if most people were asked, they would say, well, if you're not going to provide any support services, this thing is just going to keep going and going and going. So I was really happy to hear Danielle, because when I toured, I'm thinking to myself, wow, I don't think want to be alone and being able to interact with folks here, because some of them seemed like obviously they had some challenges. So I just wanted to mention that, and you can fill in the blanks, if you will.
Yeah, absolutely, Brian. And what you're referring to is a presentation by one of our clinical managers on the street outreach program, which is literally what it says. It's getting out to individuals, in particular living on the streets, homeless. The one thing, and you're absolutely right in terms of how the state certainly approached this issue, and of course Rutland County had the most willing hotel operators that would accept the state's daily rate to house individuals, and we know that Rutland City, Rutland Town had a disproportionate share of individuals in that particular program. The one thing that and again, this goes back to all my years ago, working in economic development in downtown, is the fact that this community, this Rutland community, it's really something special in the fact that organizations work so closely together without fear of somebody's trying to take over my business. The homeless, the homeless situation is a great example of that. While we are offering, street outreach services and clinical services, and of course emergency services when necessary, but so many organizations, Companions in Wholeness, for example, which is operating out of the Methodist Church, which is right on Strong's Avenue, right across actually from Gills. We work closely with that organization, which is doing just phenomenal work in terms of helping people meet basic needs. You have the Homeless Prevention Center that does this work. Of course, you have Brock Community Action, and you have the Housing Trust of Rutland County, which I believe has a new name now. But these organizations, all of us work very closely together. And in the case of the situation with respect to how the state went about the placement of individuals, it was poorly designed. And your point is absolutely correct, which is in many cases, this was if you build it, they will come, and they came. But so many people came and had so many other issues that if they were not addressed, they would remain in that situation. And Danielle gave some great examples of that in terms of the work that we do. But these problems are big, and they don't have a single solution. They have solutions that are, in many cases, cobbled together by willing partners. And again, the Rutland community, time and time again, has brought together the best of what it has. This has not been an easy situation to deal with. The city of Rutland has of course, we work very closely with the mayor's office on this as well, because they want to make certain that Rutland City is has the resources that to help these situations, so that the burden is not unduly placed upon the city, and of course working with them very closely. But one of the things that Danielle talked about, and she and others, would be an interesting conversation to have with some of the other groups on this program. But so many of these individuals, something has happened along their life to get them. You've heard the old phrase, but for the grace of God go I. Well, it's not that far from the truth. We all remember, showing our age, Trading Places. Remember that great movie with Dan Aykroyd and Eddie Murphy? And, you look back on something. If you haven't seen that movie, go and watch it. That's one of the classics. It was a ways back, but it was one of the classics. In many, many cases, something really bad, something really traumatic. We sometimes think of, an individual that does not have stable housing, for example. They're just lazy, or what? Well, look, there's lazy professional people, right? There's lazy in every profession, every walk of life. But in many, many cases, something happened. Could be addiction, substance use disorders, mental health disorders, family, domestic violence and sexual violence. And we encounter that on on a very regular basis, and Danielle talked about that when she gave her presentation to the delegation. So it's really bringing the best together of really understanding that, you're dealing with individuals, and I think that just because of the bolus, the number that the state placed in Rutland, I think just was overwhelming. And we've always had homeless in Rutland City, Rutland Town, but it was that change in how the state went about it during the pandemic that really tipped the scales and created an undue expectation and burden on providers, social service providers, to do something about it. And that's sort of where we're at right now, is that while the numbers are lower, and that's a good thing, and as was pointed out at the meeting, in some cases, folks went to live with a relative or found a friend that they could live with. They were able to secure some other housing, even though we all know housing is in short supply in this region. All types of housing and all levels of price. But nevertheless, in many cases, what we're dealing with is folks that if they are not getting certain supports above and beyond a roof over their head, does not provide them with what they're going to need to get out and be able to do what they really want to do, which is lead productive, healthy lives. So there's a very, very small minority of people that just take advantage of the system. Yeah. I mean, to be honest, it's because I hear it. I hear it in my work. I hear it in my community, friends, whatever. All these people are just taking it. Well, there are some people. It's human nature. But the lion's share of folks, they don't want to be there. Yeah. They don't want to not have a roof over their head. They don't want to have to know that their child is living in a small hotel room, whatever. And it's so easy to say, well, it's because they made this decision, or well, that may be true in some cases. But I don't think the approach is to just dismiss that and say, well, be on your merry way, because that has very negative impacts for the community. We're talking to Dick Courcelle, who's the Chief Executive Officer of Community Care Network, which includes both the Rutland Community Programs and Rutland Mental Health Services. We need to take our first break on the show. We're about halfway through, as a matter of fact. I do want to mention, when we come back, some of the changes that will be coming our way with respect to the Developmental Disability Services System. And I know we did a presentation on that at the delegation meeting as well. So we'll pause here on Catamount Community Connection, and we'll be back with Dick Courcelle in just a moment. Welcome back to Catamount Community Connection, our show brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. And I know I am already looking forward to the 179th Fair, which will be coming up this August down at the Vermont State, or the Rutland Fairgrounds. It's the Vermont State Fair. Dick Courcelle is our guest today. He is the CEO of Community Care Network, which includes both of the services that we've been telling you about, Rutland Mental Health Services and also the Rutland Community Programs. One of the things that came out at the delegation meeting was a change that I guess I'll call it an overhaul. But that sounds sometimes like it's a positive thing, and I'm not quite convinced that this is a positive thing. But I'll let Dick explain what's going to be happening here with especially the population that depends on us for some disability services. And so what's down the road for us? Yeah, this is trying to explain this in the simplest of terms so folks can understand. Those of you of a certain age will remember the Brandon Training School, which is just in Brandon, and it is now just a collection of a lot of different businesses. But for many, many years, the Brandon Training School was the state's institution for individuals that were born with developmental disabilities, or in that back years ago, it was called mental retardation. That is not a term that's used anymore, but that was what that was. And many individuals would go there from birth. And it was just assumed that somebody that had a developmental disability would not be able to function in their community with supports, and so we would create institutions. And so this was the way it was across the country. In fact, my first job out of college, when I worked for Children's Hospital down in Boston, Children's Hospital had the medical contract from, at that time, was the Wrentham State School, Wrentham just being down the road from Gillette Stadium. That was back when I could actually go to a Patriots game, buy the ticket on that day, and not feel like I was having to take out a second mortgage for it. But anyway, I digress. So back in the 1990s, Vermont, like every other state across the nation, for the most part, got rid of those institutions, those facilities, feeling like it would be better if we could create systems within the community, support systems, families that would be willing to take individuals in to live with them, do a lot of supports. And that evolved over the years. And Rutland Mental Health Services is certainly, with Brandon being in our backyard and part of Rutland County, developed one of the first developmental disability services programs in the state. So this would have been in the mid-1990s. And that program has grown. We serve about 400 and it's over 480 individuals as of first part of July. And what this is there are a range, when we say developmental disabilities, there's a whole range and spectrum of developmental disabilities. We have, of course, everyone is familiar with, childhood autism and moving on the continuum. And then there are more types of developmental disabilities that an individual may have early in life. It's usually before the age of 18 for it to be classified as that. But in any event, so there have been, over the years, many, many programs built around helping individuals with a developmental disability be as engaged in their communities as possible and successful. We have a very strong employment program that works with, and we have some fantastic employers in this region who welcome individuals with developmental disabilities, and we have folks that work with them in their places of business to engage, because having a job for someone, and we all know having a job is important. It helps you with your self-esteem. Gives you a little spending money, but more important, you feel engaged. We have a lot of programs along that line. We work very closely with Rutland Regional Medical Center on Project Search, which is a phenomenal program where folks that are like last years of high school work in an environment, and they all become employed at some point. Shortly thereafter. It's a phenomenal program. But in any event, there are scads of different programs, community-based programs. We do have some residential programs as well for individuals. We have about 130 what are called shared living providers. These are people who have opened their homes to an individual or a couple. In most cases, it's one. And who are providing care and oversight and helping these individuals remain as active and as engaged in their community as possible. Well, the system as we know it is all changing this year, and it's changing because the federal government, the Centers for Medicare and Medicaid Services, notified Vermont a number of years ago, I think it was 2014, because these services are provided through federal funding to the state of Vermont. And so the federal government notified the state of Vermont that you're not in compliance with what we call the conflict-free rule. And just to make this clear, conflict-free means that if you are, let's say, assessing an individual, you're determining what that individual's needs might be, and you are wrapping services around there. You're creating a plan for that individual. It would be in the eyes of the federal government, it would be a conflict should that same entity that is doing that work at the beginning also be providing the services. Now, one could argue that that's kind of silly. Can you imagine if you showed up, let's say, at the hospital in the emergency department, and you had to have diagnostic imaging or whatever, and it found something, and you needed to have surgery. but you were told, well, because we assessed you and diagnosed you, you're going to have to go somewhere else to get it done. I mean, I know that's in simplistic terms, but that's sort of what is happening here. Be that as it may, this is the way it is across the country for most states when it comes to developmental disability services. So this year, and the state of Vermont is soon to announce, organizations like Rutland Mental Health Services, and there's 14 organizations statewide that are providing developmental disability services in this fashion, are going to have to separate the work. No longer will we, for example, be doing the assessments on individuals. We will no longer be doing the planning of care for that individual. We will no longer be putting together a package of services for that individual. Why? Well, because we are the organization to actually provide those services. Now, could there be a conflict? I've never seen it in my years because that's not the way you get paid. It's not like we get paid for doing more in this arena. So, but this is what the state has to do. So in the next few weeks, we are to learn of what organizations, and we understand there might be up to 3 in the state of Vermont. Some may be out-of-state providers, and in fact, I think at least one perhaps will be taking on these duties. What's going to happen with our organization and the 13 others that are doing this work across the state is we're going to have to then pivot to only providing services that someone else is designing and someone else is saying is needed. It's complicated. In many cases, they don't know the individual that well. And whether or not we can even provide certain services will not be known by that agency. So we're doing everything we can, working with the state and also working with all of our families and individuals that are receiving services now to help them navigate this new world. It's not an option. This is happening in the state. This is not something the state of Vermont just decided, boy, we really should do this. This is something that was I don't want to say forced upon them. Oh, yeah, it was really by the federal government. Yeah. So it's going to be a period of transition. What we want to ensure is that for all of the individuals that are receiving services from us in developmental disabilities, that we will be working very closely with the what are called case management entities, or the ones that are going to be providing the assessment of the services, and making certain that we're in close coordination and deliver the services the individual needs. I suspect there will be issues along the way and coordination issues, but over time, hopefully, we'll be able to remedy that. But it's a big change in how things have been done.
I also assume, and maybe incorrectly, that it will be more expensive to do it this way because what you have right now, in essence, is the very same, and your analogy I thought was great. To me, it's kind of like you need pipe work done in your home, and instead of going to a plumber, you go to a carpenter and say, well, okay, the plumber said that maybe they should do this, but you're going to be the one doing it. So we now have 3 entities, to me, that will charge somebody. There'll be money exchanged for their services that are already being done right now by the same group that's going to do the work later. And so I don't know where that money's going to come from.
Yeah, I certainly, the services are first and foremost, but you're absolutely right, Brian. I mean, the fact of the matter is that this work needs to continue. The services need to be provided and funded by the state. I'm sure we're very much involved in it's a whole new payment system, which I'm not even going to get into. That is very, very complicated. But one does wonder, is this going to actually do what the state thinks it's going to do, which is be what's called budget neutral, which you, of course, in the legislature knows means kind of the same, no new money coming into the system. I don't necessarily see how that's going to be the case when multiple entities now are entering into the picture, or what could potentially happen is that there is a loss of funding for the organizations providing the services because it's got to go somewhere else. That's to be seen. We certainly, and again, the state is forced into this. They're working on it now, but I can tell you that there's significant anxiety, and I'm using that term the way it should be used. There's significant anxiety on the part of all organizations in the state providing these services now, because no one wants to see a lessening, lower quality or fewer services provided to these people, these individuals who are members of our community and are engaged in our community. We don't want to see that. So we're keeping a very close eye on it, as all agencies are in the state of Vermont. And I'm sure as the legislature, there's going to be certain committees in the legislature that I will be receiving reports on how this work is proceeding. By the end of this year, it has to be fully enacted. And I suspect that, there's going to be some ups and downs. I'm hoping there's more ups than downs. But as I said this morning, as we were talking about all the things that were changing, what could possibly go wrong? Of course, I was being very facetious when I said that, because the answer to that is lots.
A lot. We're talking to Dick Courcelle, who is the CEO of the community programs and the Rutland Mental Health Services, all under the umbrella of Community Care Network. We have a couple more topics. We need to take a break here in just about a minute. By the way, congratulations to you for being the recipient of the Governor's Award for Wellness, the Vermont Department of Health's Gold Level Worksite Wellness Award, and that's quite something to tout. And you also were one of two groups that were selected by Vermont Department of Mental Health to do something else that we haven't been doing yet. And maybe actually, let's take our break now, because I don't want to have to interrupt you in the middle of that. So those are the things that we have coming up. And again, we're talking to Dick Courcelle, and we will be back in just a moment with our final 10 minutes or so of the Catamount Community Connection program. We're back on Catamount Community Connection, and it's our weekly Sunday public affairs program. Dick Courcelle, our guest today. He's the Chief Executive Officer of the Community Care Network. So let's talk a little bit, Dick. Congratulations again for the award. And talk to us about the Vermont Department of Mental Health's selection of your group.
Sure. Again, this is very exciting for our organization, and we'll be providing enhanced services to our community because of this. The federal government back in, I think it was like 2016, whatever, looked at how best to design and deliver programs, mental health and substance use programs. And they came up with what is called the Certified Community Behavioral Health Clinic model. Now, what that is, in essence, it's a series of there's 9 core services, and I won't get into all of that. But in other words, it was designed as kind of the gold standard for how community-based mental health and substance use services should be delivered. And the federal government created enhanced funding. 8 states signed up to be the first states to join what is called the CCBHC Demonstration State Program. Vermont has been keeping its eye on this for a while, and a few years ago, about 3 years ago, we, Rutland Mental Health Services, applied for a grant from the federal government, a 4-year grant to help us build towards this, which we realized would really enhance services for our community. And we received the grant. We were very fortunate, highly competitive grant, and we've been building that capacity since. The state of Vermont now has been accepted into that state demonstration program. The federal government is wanting to add 10 states every 2 years until all 50 states are part of this. So what this is looking at a whole continuum of services in mental health and behavioral health that enhance what is benefit, how the community benefits from it. Significant amount of expansion, in particular in our substance use program. We are now doing primary care screenings. We are, there's a whole array of other services we're offering, a focus on veterans' mental health, peer outreach. Peers are individuals who have walked the walk, and expanding that, because in many cases, someone having a particular mental health issue having someone to talk with them who has gone through that can be very powerful for them. And there's a host of other services that are part of this that we will be able to offer to this community with this new designation. So the state of Vermont, after receiving its acceptance into this program by the federal government, selected two designated agencies. I referenced designated earlier in the program. Rutland Mental Health Services and Clara Martin Center, which is in Randolph, to go through a process to become officially certified, and we are expecting that the 1st of July. What this will do is provide the funding to offer expanded, enhanced services in mental health and substance use disorders. So we're very excited about what we're going to be offering our community with these new services that we would not be able to do under our current model. And it's something that the state of Vermont is really looking at expanding. We do believe it is the gold standard in terms of really wrapping care around individuals for what they actually need to get through, whatever the recovery might look like. So it comes with enhanced funding, which allows us to be able to hire staff to be able to provide these services. We've increased our psychiatric capacity, our substance use capacity. So this is really going to be a game changer for us, and we're hopeful for the community. And we work with a lot of community organizations across the region that are work with us on this because, again, as I said earlier, we don't do this alone. In many cases, issues may require the hands of other agencies who provide certain levels of care and support. So we're excited about this.
We're talking with Dick Courcelle, Chief Executive Officer of both the Rutland Mental Health Services and the Rutland Community Programs. And I know Dick's got to head along for another call, even though you're listening to this on Sunday morning very early. We've recorded this on Monday the 20th. So I'll let Dick just head out, and I'll continue to talk about some of the legislative potential changes that'll be coming up. Dick, thank you so much for joining us. I'd love to have you come back on.
Absolutely.
And we'll see you back in Montpelier, I'm sure, at some point.
You definitely will, Brian. Thank you very much.
Okay. So on the horizon are probably 4 or 5 topics that I will be involved with at some level. The governor will have his budget address coming next week to the legislative body, I should say, and there'll be a joint session. We'll talk about the energy changes that potentially will be coming up. The Public Utility Commission, which has been charged with coming up with a plan as to how to implement that Global Warming Solutions Act, and within that, the Clean Heat Standard. We spent almost $2 million, by the way, having the Public Utilities Commission make a study. And in the end, and it was just released last week, they've decided that it won't work for Vermont the way it's set up. So there will be some changes, I think. I do believe that the Clean Heat Standard will be repealed and something possibly in its place somewhere down the road. I don't think that there's much appetite to do anything more this year. The private right of action remains in the Global Warming Solutions Act. So anybody in the world, not just anybody in Vermont, but anybody in the world can sue Vermont for not meeting what it has declared to be its mandated goals in terms of energy situation. So we'll see what happens with that. I will be very clear. I will vote to get rid of the Clean Heat Standard. That was just something that became very obvious to me when we took that up before. My constituency was like 90% against that. So I will be voting to repeal that provision, and I'd also vote to repeal the private right of action as well, so that we're not, and we're already facing one lawsuit from the Conservation Law Foundation. The big issue this year, though, will be changes to our education system. And I think you will see both in the governor's budget next week and also in the committees that will be deciding what policies to enact going into the future. So both the Senate Education and House Education committees, there will be, I believe, some very significant structural changes to the way that we structure our educational system and certainly the way that we pay for it. And that may include some very, very painful choices in terms of consolidation and income situations for those who are, and we're all paying with property taxes right now. So that is the big thing on the calendar, the education changes and the energy. There also will be continued efforts, I believe, with respect to housing. We did a little bit of reform last year with Act 250. Rutland City made out very well. They've been designated as a Tier 1 district, so they won't have to put up with a lot of the Act 250 proposals right now, or I should say provisions. I don't mean put up with, but they have to go through them right now. But that will be some relief for the development, especially for the downtown hotel that hopefully, I think we all hope will come and be built. But I think there's other communities in the county and in the state that would like to do development, maybe only on a project-based situation that right now can't without going through the entire process. So I think there's more Act 250 reform that would be invited, and we'll see how much more we can get done. The governor's already announced his choices for changes to the public safety laws. One of the things that will be considered, at least, will be a repeal of what's called the raise the age requirement. I believe right now, if you are 19 years of age or younger, you are to be considered a juvenile in terms of many of the court situations. And this will move up to 20 years of age unless something is done. It'll move up automatically based on legislation that's already been passed. So the governor has proposed that we repeal that provision, and I would support that. I think, again, in very plain terms, if you break the law, you have to know there will be consequences. And to me, we still need to come up with one age of majority. And there's arguments for 18 that make sense. There's arguments for 19 and 20 and 21, but we have a scattered approach to that right now. You can do some things at 18 that you can't do until you're 21, etc. So I think we need to have one age that recognizes this is when people of a certain age can make intelligent decisions. And I don't know what that age is. I'm wide open to having people tell me. I know there's a lot of research that's been done recently that says that the human brain doesn't develop until you're well into your 20s. Well, if that's true, then you probably shouldn't be voting until that is true. If you live in either Brattleboro or I believe it's Winooski and maybe even Burlington, you can now vote at 16 as long as you will be at that age by the time the election is held, only in local elections, not statewide, but in local elections. And so, again, you've got a situation where someone's 16, then someone's 18, and then someone's 21, and there's different responsibilities and opportunities for each of those. I do want to mention, and I have introduced a bill since I've been in the Senate. This is my 11th year in the Vermont State Senate. That I think we need some relief and some recognition for our veterans. So I have put in another bill this year that will exempt military pension retirement pay for that veteran and also the survivor's benefit income as well. And that has been referred to the Senate Finance Committee. It has been referred to that committee every year since I introduced it back in 2015. So far, it's never come off the wall and never been taken up. This year, I did work extremely hard, I felt, and I got 21 total sponsors of that bill. So 21 out of the 30, a full 70% of the Senate supports this measure. And I do know in my heart, if we get it to the floor, it will get passed. I see it both as just doing what's right for our veterans to honor them for what they did, and also as an economic tool. All too often we see people move out of Vermont, veterans especially, because we still do tax their retirement income and our income tax. And so they leave, and it prevents or at least inhibits others from moving into the state who otherwise could help us out with tax situations, and also they have particular skills that could be used by a lot of our employers. So there's a companion bill, and I'll recognize Representative Bill Cantfield from Fairhaven, who put in a companion bill, a mirror bill, in other words, the same exact language in the House. And from what I'm told, they came up with, I think, 75 out of the 150 members of the House to sign on to that. So again, you've got what I consider to be pretty impressive support on both sides of the Vermont General Assembly, and I'm hoping in that case it's the House Ways and Means Committee that will be taking that one up, and I'm hoping that they will. And again, I think if it gets to the floor, we have a pretty good chance of finally getting income relief to our veterans, and hopefully seeing people actually move into the state as a result of that. So I'm looking forward to hearing the governor's budget address, which will be coming up next week. And there'll be, I'm sure, a lot of questions about it from a lot of different people. And that's the way it should be. I've been up there, as I say, 11 years. We've never just taken the governor's budget and said, yep, that looks good to me. Let's send it on the way. We change it all the time. The House, because it's a money bill, gets first crack at it. So it goes to the House Appropriations Committee. They will take a look at it, make whatever necessary changes they feel should be made to it, and then it gets sent over to the Senate, and the Appropriations Committee in the Senate takes it up, and then it goes to the floor. So it won't look exactly like it does right now in terms of the governor's recommend. That's what we call it, the governor's recommend, or the governor's recommended budget, but that'll be coming out next week. So again, education changes, energy, housing, and further Act 250 reform, public safety, veteran bill, and the budget address. All of that coming up in the next week or so. Some of that won't be taken up necessarily in its final form next week. The budget address will be delivered, but the education changes, I think, it's going to take most of this session to iron out where we go with that, how we pay for it. So a lot of that on the way, a lot of it more to come. So anyway, our show again brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair in Rutland since 1846. The 179th Vermont State Fair is headed our way this coming August, and I hope everybody gets down there and supports it. Our fairs are so important to, I think, our culture here in the state of Vermont. So that is our program for the day. And again, I want to thank Dick Courcelle, who is the Chief Executive Officer of Community Care Network, which includes both the Rutland Mental Health Services and Rutland Community Programs. They do an outstanding job, reaching about 3,700 people in our area and employing about 300 people. And we had a legislative delegation meeting with that group. And my tip of the cap to them. I think they're doing tremendous work, and hopefully they will continue to do that. So that is the show this week. We will see you all next week on Catamount Community Connection.